Today I'm going to be talking about facial aesthetic surgeries such as facelift and neck lift. The main goal of the facelift surgery is to fix some signs of aging in the face. What are these signs? For example, jowls, deep folds in the smiling region and around the mouth, skin laxity, and the saggy mid-face and saggy lower face. The ideal patient for facelift is who has signs of aging, just I mentioned, and ideally over 45 years old. And our aim is to fix all these signs of aging, including lifting the mid-face and lifting the lower face. So there are many ways to perform a facelift. Mini facelift, endoscopic facelift, temporal facelift, regular facelift, deep plane facelift. All these surgeries are reserved for some specific patients. What I perform mostly is extended deep plane facelift. In this technique, we cut in the hairline and in front of the ear, and generally our incisions are barely visible. The main difference of an extended deep plane facelift is we release all the attachments in the face and dissect the deep tissues almost to this line so that we can mobilize the face freely, and then we can lift the face whatever vector we want and fix there so that we can have a more long-lasting effect and a better effect. What I do differently is I prefer to use some sorts of sutures in a vector that has been not described before. So in some parts I do my own modification for the extended deep plane facelift. And our aim is to make a patient look like 10 to 15 years younger. However, it doesn't mean that it stops aging. There is also another technique called high SMAS facelift technique. This is also a type of deep plane facelift technique, but I rarely do it nowadays because when I do an extended deep plane facelift, I have all the advantages of a high SMAS facelift technique. High SMAS facelift has a direct effect for mid-face lift. So when I do an extended deep plane facelift, when I arrange the vector and then when I release all the attachments, actually I have the same effect of a high SMAS facelift technique. So I prefer an extended deep plane facelift over a high SMAS facelift technique because I can use all the advantages of high SMAS facelift technique. A lot of patients ask me about mini facelift. Mini facelift is so-called mini. There is a mini incision here. Actually, this incision is almost as the same length as a deep plane facelift incision. So actually the scar is almost the same in length. However, in a mini facelift, we don't raise the deep tissues called SMAS, but we just pull the skin. So we cannot lift the wrinkles around the mouth and the jowl line. So it just has a mini effect like that. And because we cannot suspend the deep tissues, the scar generally heals very bad. So this is the disadvantage of a mini facelift. So in my practice, I rarely use a mini facelift. And another question which is frequently asked to me is why a deep plane facelift is more expensive or why it requires more expertise. The reason is when we go to the deep tissues in the face, we encounter a lot of nerves in the face, and this requires expertise. So we need to dissect all the nerves and protect them so we don't have a facial palsy and lift the tissues up. So that's why it requires more expertise. The reason I'm very comfortable in this field is because I do a lot of reconstructive surgeries in the face as well, including head and neck cancer reconstruction, facial palsy surgery, including muscle transplant to the face, and nerve transfers and nerve repairs. That's why I'm very comfortable doing extended deep plane facelift, and I do see a lot of nerves in the face and protect them all. After a facelift surgery, generally our patients stay 1 night or 2 nights in the hospital, depending on the extent of the facial surgery, and then we discharge them and we routinely see them every day in the hotel. For those who come from the States, I suggest staying here 10 days after the surgery, and for those who come from Europe, I suggest at least 7 days after the surgery. Smoking has some important adverse effects on healing and sometimes may lead to skin necrosis. Actually, deep plane facelift has a protective effect compared to a high SMAS facelift because we limit the skin dissection, so actually the skin necrosis risk is lower. However, still we advise our patients to stop smoking 4 weeks prior to surgery. And another important thing is we do not suggest operating on the day of arrival. Generally, we want the patients to have a rest for a day and the next day we do the operation. And if the patient has any comorbidities like serious problems, heart disease, lung disease, surgeries or anything, we may have to ask a consultation when the patient arrives, and another department consultation may be needed. After the surgery, I prefer using hemostatic net. It's some sutures over the face, which we keep it for 3 days. After 3 days, we take them out so that there will be no marks. So it's just completely temporary. But the main advantage is it almost completely stops bleeding and hematoma and seroma risk. So we feel more comfortable and our patients are happier. And what's more, I advise my patients to walk and mobilize as soon as possible after the surgery to prevent some complications called like clots in the leg and embolia.